chronic constipation, obesity or pregnancy, previous abdominal surgery, trauma or injury to abdominal muscles. Signs and symptoms of the hiatal hernia is sometimes it can be asymptomatic but also sometimes kay kanang ubanan siya of reflux, heartburn, visible bulge or swelling under the skin, nausea or vomiting, heaviness or pressure sensation in the affected area, tenderness or redness over the hernia site. Then treatment niya is life cycle changes, which is mag-exercise ka and healthy foods ang imuhang kanon. Truss, analgesics, craniography, cranioplasty, and laparoscopy. Next. So this is the example of imaging modality. In the first picture, this is an example of inguinal hernia, which is common in men. This is a computed tomography of inguinal hernia of a 96-year-old man. Also well defined are the femurs, showing the lesser trochanters projecting posteriorly, and the ischial tuberosities. And the next picture shows the computed tomography demonstration of a large anterior abdominal hernia containing multiple loops of bowel and possibly some large bowel without evidence of obstructions in this 70-year-old man. So dili siya makita diri nga najud ay naka-obstruct, but then again is wala na siya murag wala na siya ga-bulge out. Next. So this third picture, then kaning picture A, this one, is an upright abdominal view of a 3-month-old, indicates multiple dilated loops of bowel with air and fluid levels present, suggesting a mechanical bowel obstruction. And this second picture, picture B, is a prone cross-table lateral views, shows the small bowel forming a beak-like projection at the point of obstruction in the internal inguinal ring in this incarcerated hernia. So makita niyo ang murag ka ng big bitaw page. Next. So this is the fourth picture sa picture A, it demonstrates the contrast material above the hemidiaphragm on an upper gastrointestinal series of a 51-year-old woman. Then the picture B, the esophagus narrows to the stomach, which is seen to be empty possibly above the hemidiaphragm in the sliding hiatal hernia. So as makita ni mga yung esophagus kay gamay siya patulong sa stomach, but then again kapas through ra ang food nga on its own way. Then next is the katong scratching ring present sa inguinal. Muna siya kanyang arrow to demonstrate in the case of sliding hiatal hernia kanyang arrow sa kuan. So this picture A, is the paraesophageal hiatal hernia, demonstrating narrowing in the fundus. And the picture B is the lateral view of the same patient, demonstrate the cardioesophageal junction in its normal place below the hemidiaphragm. The fundus is highlighted by radiolucency of the lung. Then this picture is the intrathoracic stomach, which is katong ang imong stomach kay ibabaw na siya sa imong diaphragm. It is indicated by the presence of the entire stomach above the diaphragm. So mato kong giingon. Also with malrotation, which is discussed by previously ni Grace, and malrotation of the stomach. Next. So our next topic is the bowel obstructions. So, as we all know, bowel obstruction is a condition in which the normal flow of intestinal contents is blocked or kanang partially blocked, which is dili tanan ang makalusot pero naiuban. Then completely blocked or kanang wala jud oy bisag usab-bisag blood nga maka-pass through. This bowel obstruction prevent the food, fluids, and gas from passing through to the intestines. Both the small bowel and the large bowel of the normal person are nearly always active in the peristalsis. Then na siya two types of bowel obstruction. Kindly read the first type, Grace.
Mechanical bowel obstruction is one in which the lumen of the bowel becomes obstructed.
So, meaning ang intestine ana is na siya oy nag-bulge out. Then second ay sa mechanical bowel obstruction is naanap siya ilaing types of mechanical bowel obstruction. First is the simple mechanical obstruction. It does not involve with the blood supply to the bowel. So katawag gingon ganiha nga na siya naka-blockage pero pwede ra makapass through ang dugo. Then second is the strangulating obstruction may lead to bowel infarction. Most are caused by incarcerated hernia. So strangulating obstruction kato na siya na obstruct na siya completely. The causes of the bowel obstructions. First is hernias, tumors, volvulus is katong mo twist ang one part of the intestine slides or folds into another part like mura siya o basta malukot gani na siya. Then intussusceptions is mura siya magtambaw like ang part sa intestine nga kani is matambaw siya sa pika so ma-fold siya. Then post-operatively adhesions, gallstone. Ang gallstone ileus, kabalo mo sa gallstone ileus. Pana siya condition nga as we all know nga gallstone meaning bato sa gallbladder. Gallstone ileus is a condition that the gallstone may erode in the gallbladder, of course. But it can lead to obstruction kung moabot na ang gallstone sa atuhang ileocecal valve. Then, signs and symptoms is abdominal distension, abdominal cramps, vomiting, progressing to bloody stools. Then, treatments niya is NPO or nothing by mouth, the IV fluid therapy, nasogastric NG tube, decompression, and surgical procedures. Second type of mechanical bowel is the paralytic ileus. It is also known as the adynamic ileus. It is a failure of normal peristalsis. So the intestine fails to move contents due to the loss of normal peristalsis. So as we all know, ang peristalsis ang nagdala sa atong intestine para ang musulod niya is magpadayon or ganig move. So if mo stop mawala ang ma-fail ang normal peristalsis, which means na dili na pwede makapa-move ang mga food intakes nga naabot sa atong intestine, so ma-block siya. Then causes niya is surgery, due to surgery, intraperitoneal infection, bowel ischemia, certain drugs, electrolyte imbalance, pancreatitis, reaction to any stressful illness. Signs and symptoms: distension of the abdomen, abdominal cramping, and vomiting. Treatments includes nasogastric suction, medical stimulation of the bowel, colonoscopic decompression. So, ang paralytic ileus is generally dili siya mo last longer than 3 days if nara jud siya sakto nga treatments. So, if wala siya sakto nga treatments na instances nga mas mudugay pa ang paralytic ileus. Next, this is the example imaging modality. First picture is the abdominal radiograph demonstrating a mechanical bowel obstruction with numerous loops of dilated bowel seen within the mid-abdomen. The patient had an acute onset of abdominal pain, nausea, and vomiting. Then second picture is mo ni siya ang example pictures of the herniation. So, mubulge out siya, adhesions, kana siya. Then kining volvulus, so na twist. Then intussusception na fold. Then this picture right here is a barium enema radiograph depicting a cecal volvulus. Note how the column of barium stops at the level of the volvulus. So, nasa yung barium nga intake. Since ang iyahang intestine is ang iyang kuan is kanang na twist, so na-stop dito, wala na kapadayon ang barium enema. Next picture is the picture A, kung itong nasa ibabaw, is a pediatric barium enema demonstrating intussusception. So, dili kay siya maklaro ninyo, pero as you can see here in our PPT kay na-fold jud niya, na-merge na na-fold. Then, the picture B is after resolution. So, after na-resolve na ang intussusception, ano na siya ay itsura. Second, next is abdominal radiograph demonstrating error in the biliary ductal system. Then, next picture is the abdominal radiograph on a post-operative patient demonstrating paralytic ileus. No, the dilated bowel loops extending through the large intestine. So, mo na siya example sa paralytic loops. Next is neurogenic disease. So, hepatitis. So, first of the neurogenic disease is the achalasia. Please read, James.
Neuromuscular abnormality of the esophagus. It occurs equally in men and women. The distal esophagus itself is often described as having a beak appearance.
So, muna siya. Ang achalasia, it fails to relax properly and the muscles of the esophagus lose their normal peristalsis. So, wala na nag-function ang yang esophagus. As a result, ang imong gi-intake nga food and liquids dili siya makapass through easily down into our stomach. It occurs equally in men and women. Right. Then the causes is first idiopathic, secondary